Hello and welcome to our liver transplant education program. Today we are here to guide you through some important aspects of your care after your transplant, so you can stay healthy and enjoy your new life. First, let's talk about the key aspects of your post-transplant care. It is essential to understand that your body is adjusting to a new liver, and this process requires ongoing monitoring and care. Here are 4 main areas we will focus on: medications, lab work, clinic visits, and communication with our healthcare team.
Let's start with medications. You'll be on medications called immunosuppressive medications for life, as they will prevent your body from rejecting your new liver. It is important to follow your medication schedule, and essential your support person helps you early in your recovery to ensure that your medications are taken correctly. Please note that any changes to your transplant medications should only be made by the transplant team. Also inform the team if any of your healthcare providers prescribe a new medication. Notify your pharmacy at least 1 week in advance when you need a refill, as it is especially important that you do not run out of your transplant medications.
Let's talk about lab work. Regular blood tests are crucial after your transplant. These tests help us monitor your liver function and check for any signs of rejection, infection, or complications. You will have labs run twice weekly in the beginning and then less frequently as your recovery progresses. It's important to keep all your lab appointments as they provide us with vital information about how your liver is doing.
Next, let's discuss your clinic visits. You will have scheduled follow-up appointments with our transplant team. These visits will be frequent in the beginning to ensure that you are recovering well from the surgery, and less so as your recovery progresses. These visits are essential for assessing your surgical wound, your overall health, and ensuring that your liver is functioning properly. During these appointments, we will review your lab results, adjust medications if necessary, and address any questions or concerns you may have. Please make sure to attend all your scheduled visits with your support persons, as they play a key role in your recovery.
Now let's talk about communication. It is vital that you stay in touch with the transplant team regarding any liver-related complaints or concerns. If you are not feeling well or have any changes to your health or are admitted to an outside hospital, please reach out to us immediately. Early intervention is key to addressing any potential issues before they become serious. You will be assigned a transplant nurse coordinator who will be your go-to team member who is available during normal business hours. We have an on-call team that is available to you after hours and on the weekends that will field any urgent concerns you may have. We are committed to ensuring you have care available to you around the clock.
Here are a few tips for effective communication with our team. Keep a journal of any symptoms you experience, noting when they occur and their severity. Please ask questions during your appointments. It is important that you and your support team feel comfortable with your care. If you are unsure whether a symptom is significant, it is always better to call us and check. Setting up your UC MyChart is a valuable tool to keep in touch with your transplant team.
Remember, you are not alone in this journey. Our team is here to support you every step of the way. Your and your support team's involvement in your care is crucial for a successful recovery. We want you to thrive after your transplant and enjoy a healthy, fulfilling life.